Hello, we'd like to welcome you to the CTSNet Roundtable, in which our participants will be discussing the changing role of research for academic career advancement. We're filming here in Vienna in conjunction with the EACTS 2017 meeting. My name is Mara Antonoff. I'm an assistant professor of thoracic surgery at MD Anderson Cancer Center in Houston. I'd like to welcome our panel of guests. Can you each please introduce yourselves?
I'm Pavan Utluri. I'm one of the I'm an assistant professor of surgery at the University of Pennsylvania and an academic cardiac surgeon.
My name is Marco Torina. I am a professor of cardiovascular surgery at the University of Zurich in Switzerland.
My name is Moritz Weiler von Balmus. I just made a transition from Duke University to Houston Methodist Hospital as an adult cardiac surgeon.
Terrific. We're discussing today the role of research in advancing one's academic career. Dr. Torina, can you tell us a little bit about how you see research fitting into that progression, from student to trainee to seasoned academic surgeon?
I think that it is absolutely essential for today's academic surgeon to go through a thorough research training, much more difficult than it used to be 20, 30 years ago, when a part of residency was in the lab, but still it is necessary for academic advancement. You have to sacrifice quote unquote year or two at least for a thorough research preparation, but then the way is open.
Dr. Utluri, can you tell us what steps do you see as being part of the checklist in order to advance in one's academic career, specifically with regard to research?
Yeah, as Dr. Torina said, I think there's actually more of an interplay between clinical training and surgical training. And through the checklist, I think there's really, if you're with an academic focus, finding the mentor, learning the steps involved in research, and that isn't just the benchtop research, but also the real life issues, so funding, running a team, setting up the infrastructure.
Thorough training in statistics.
Yeah, statistics, absolutely. And then continuing to have a mentor really throughout your early and later stages of career as well. I think it's a continuous learning process that we can't forget that it stops once you leave the lab.
Terrific. Dr. Weiler von Balmus, how important is it for one to engage in basic science research specifically?
I think on the heels of the comments of Pavan and Dr. Torina, I think I wouldn't necessarily cast a vote for or against basic science research work. I think it's tremendous value to be engaged in any kind of research work to really get a different perspective from your clinical practice and your clinical thinking and acumen to really enrich that with research endeavor, whether it be in basic science or other kinds of research fields. I think that's a discussion that one can have, but I don't necessarily see that one is better than the other.
I will add that I think that basic science research is absolutely vital to survival of our field. Yeah. And those students who have an interest in basic science research should pursue it and not be driven away by fear of funding and time, and those kind of issues can be worked out appropriately.
And the loss of career, because you spend 1 or 2 years out and everybody else is further than you are.
You mentioned mentorship as being mentorship as being important in that process. How else can we encourage trainees to participate in basic science if it's so important? What other aspects do you see as being critical to helping them pursue their dreams in basic science research?
Yeah, I think please also contribute your thoughts as well, but I think the real keys are what specific aspect are you interested in, and then really finding the mentor that can. I really do think it comes down to having the appropriate mentor and the appropriate teaching, but really finding someone who can guide you through the appropriate pathway and really show you sort of the ups and downs and guide you through the early potential failures that may exist if you don't have that person.
Yeah, I think that's an excellent point, mentioning ups and downs and the earlier failures. I think if someone is new to the field of medicine and field of research, a young medical student, for example, it's important to score some early successes to keep their and maintain their interest. And it may seem sometimes this is easier done with clinical research, a small case report or what have you, because you can potentially get a quick publication out of something, but I don't think that's impossible in basic science. I think it's absolutely possible. It's how I got involved in research, how I got fascinated with pursuing an academic career and engaging in research was actually in a basic science lab, where I had the mentoring that allowed me to have some early successes on which I could build and sort of see the long-term perspective and sort of the outlook that is required to really stick with it and pursue it.
And remember, the mentor does not have to be someone within your division.
Exactly.
It's somebody that can be at your institution, potentially at a different department, or at another institution even.
Still somebody you are looking up to is an example of what you strive to become.
Absolutely.
These are all really great tips. We briefly touched on this, but Dr. Torina, do you see a role for alternative pathways of academic research, not just clinical and translational work, but what about public health, education, clinical outcome studies? What do you think about those other pathways of achieving an academic niche?
You know, the answer is very simple. It is not the basic science, it is not the applied science, whatever. It is just learning to become methodic, to become systematic in your approach, to have a basic training in methodology and statistics, and that will make you a good surgeon in any profession. You might even be in something close by near surgery, but still make a career there, for instance, the assist devices or something like this.
Sure.
But the basic training in science, this is what is most important. What we don't have in study.
I think that's true, and I often engage with trainees who express some sort of concern about being assigned to research projects that maybe aren't assigned to their exact field of interest. And I can assure you that most of the initial basic science studies that I did on mice and rats really have nothing to do with the practice of cardiothoracic surgery. They do have to do with oncology, which is, of course, related to my current practice. But I'm curious, did any of you engage in early research that was unrelated to your current field of study?
Not entirely, but I think I certainly agree with the notion that it's mostly about thinking outside of the box, having the skill set to really question the status quo, to come up with a research hypothesis, how to pursue it. And I think that's a tremendous enrichment for any cardiac surgeon, for any surgeon. And I think as surgeons, we tend to stick with what we know and try to control and do things the same way because we want consistent outcomes. So I think that's something that we learn as trainees going through surgical training, to have a certain degree of consistency. And it's dangerous to some extent because one can get entrenched in doing the same things all over again and again and not ever really deviate. And it maybe almost discourages to some extent that thinking outside of the box, which is so important to really drive the field forward, to have new discoveries, and for me personally, to also light up the day and have some excitement, you know, outside of what is exciting in the OR and what I do as a clinical surgeon.
You know, you ask a very important question, and that is, I think several people, in fact, start in a different field and move on. I started my research in developmental neurobiology, looking at nicotinic receptors. I don't do any research of the sort. But what I did gain from that experience was a deep understanding of hypothesis-driven research and the scientific question, as Dr. Torina alluded to, which is not only important in the research I do now, but it's also the way I approach patients and their clinical problems. And I think sometimes we're too quick to draw and cast big walls between basic science research, translational research, clinical research.
Sure.
It's really one big blur. It's research, period.
So Dr. Lurie, just to change the topic a little bit, once you have done some good research and you've put forward a manuscript, how can you measure the impact of that manuscript? How do we know how successful we're being with the publications that we're putting forward?
Yeah, that's a good question. If you were at my talk earlier, you'd know that at the end of my 15 minutes, I didn't really give you a good idea of how to measure impact, because I don't think we know exactly how to measure the impact, other than if within your field you're seeing the research being played in practice and changing the way people are thinking. And that's the most important thing, is contribution to the field and contribution to science, and really making an impact on, in our case, the healthcare delivery.
No, the impact, it's very difficult to measure, but it is very easy to find out after you work with somebody for 6 months. Then you know immediately how basic his knowledge is, and you will immediately see, on this one I will really put my money on.
Sure. Well, when we're thinking about our own academic careers, Dr. Weiler von Balmus, how important is it to develop a specific research niche? Is it an important part of career advancement? And if so, how do you find that niche?
Oh, that's a good question. I think I'm probably not the best example for someone who has developed a research niche early on and then, pursued only that sliver of research. I've really done a couple of different things and always dabbled in different fields of research and different research, subjects, and certainly have faced the criticism to be, a jack of all trades, but the master of none. And I would disagree with that notion as well. But I think there's some value in pursuing something for a period of time to have some consistency and really get some traction. I think you can't hop from one thing to the next and dabble in all kind of unrelated fields. But I also believe that you can be a subject matter knowledge in more than just one narrowly defined research field or subject. And I would certainly encourage people who want that kind of a career as a clinician and research to have something that's complementary, not necessarily, put everything on one, put all the money on one bet, so to speak, and really explore different options and get that different perspective that is complementary, I think.
What are your guys' thoughts on that same topic of the importance of developing a niche or maintaining competency in a number of different areas?
I think that given the current expanse of cardiothoracic surgery, if you really want to understand a problem and really work towards addressing a problem, I think it's important you focus. It's very hard to be a jack of all. You really need to master a few topics.
But it's typical for any kind of research. There are dead-end roads, something you followed the wrong masters, you heard the wrong advice. But the one you are critical towards yourself and your result, you can analyze it, coolly analyze every 3 or 6 months what you are doing. Then you will be able to rearrange your research. But this is something what gives you, any kind of scientific training gives you a systematic critical approach, and that's what it's all about.
Dr. Torina, in your career, many of your early research successes and successes actually over many years came from solving major technical obstacles and really solving a lot of huge problems for cardiac surgeons in terms of how these types of procedures could be executed. What would you say to a trainee who says all of the problems have been solved, there are no more problems that exist? And
I try to point out in my talk today, I think that medicine is far from perfect and new problems are arising every day. I just mentioned the aging or similar problems, new diseases which come up. But I think the medicine and even cardiac surgery, which is now really under fire from catheter-based techniques, cardiac surgery, it's a lot of space for improvement and for new ideas.
What advice do all of you have for trainees and early career surgeons who really want to excel in research, but they're concerned about continuing to grow in terms of their clinical practice and skills? Obviously, it's a challenging time when one first finishes their training and that they want to really continue developing that skill set in the operating room, but it's also an important time for establishing an academic career. What advice would you have for individuals in that position?
Dr. Torina?
Well, I think the American VA hospital system is still an excellent one. You go somewhere to a day-to-day practice for a period of 6 months or a year, and then you are really well trained. I had the same system in Zurich. It was a city hospital. We would send the future leaders, we would send them for a 6 months or 12 months. They would be coming back, going back into research. You have to combine both, and you can combine both research and clinical practice.
I agree. I think you can combine both. I think the important thing is don't worry as much about your clinical practice up front. That's the advice I was given. It was very hard to follow it early on. But focus on your research, build the research. Your clinical practice will certainly come, and if you have the basic science or the translational or the clinical research piece in place, you could certainly have both. You just need to be able to focus on building the platforms, right?
Yeah, I think I would certainly agree with what's already been said. And, I can offer the most generic advice ever. It's follow your passion. But I do think it's important to find something that you're really passionate about, because it's going to be extra time that you're spending. And if you feel like you're forced to do it and you have to do it because it's important for your CV, it's important, it's hard. It's going to be hard to do it. And I would just say, you know, that the world is a big place and there's so many things out there. Be patient. You know, it may take some while for you to find something you're really passionate about, and then maybe that's sort of what I was relating to earlier to it. It's okay to try out different things and then really settle when you find you have found the one thing you want to pursue, you're passionate about, and then it will be much easier to sort of bring it all together and make it work.
The other caveat that I will say is stay focused. If you want to do research, you want to have clinical practice, stay focused. There's lots of people that will ask you to do lots of things that are a waste of your time. And so stay focused on what's important, avoid the distractions, avoid the unnecessary time sinks.
So we've talked a little bit about trying to integrate research into a busy clinical practice. But what about an even broader picture? What advice would you have for new graduates or trainees who are trying to understand how to fit research in along with their clinical practice, but also in their very busy lives that include a lot of additional aspects? I was wondering if maybe we could all share some tips. For example, for me personally, I try very hard to make use of any downtime. So if I'm in awaiting a patient to be prepared by anesthesia or turnover time in the operating room, I always have extra papers on hand to be reviewing articles, things of that sort. I make lots of lists to make sure that I do a little bit of research every day, even if it's just a couple of small details that need to get done. What other tips do you guys have for integrating it into our very busy lives?
Yeah, I think we are all longing for the perfect productivity hack, and it's because we do have a lot of competing interests, and competing for time is a very common theme I find amongst academic surgeons. And I would agree. I think one thing that's worked for me well is bring stuff along for my clinical work, because there's always more downtime than you think there's going to be. There's always going to be waiting for something or this and that. Instead of bantering about anesthesia and not putting the lines in faster, I try to sit down and review a paper or write on a little bit something. So I think there's all these little things you can fit in to the day. And then it's probably also important to have to make some commitment to really set some time aside where you're going to do the bigger chunks of work, where you're going to really sit down and focus and really hammer out a manuscript.
It into your schedule,
right?
And
You can't all do it in these little. So I think it's a combination of both things that are needed.
On the other hand, you cannot get the impression that we get every year we get 6 new residents and they all will become scientists. It's totally wrong. It will be, you have to find out, all of them go through the same program, and then you spot one who has the talent. I think 1 out of 10 is a high proportion who will be able to really become somebody in science. The rest will be just getting a proper training, getting some advice in maybe their own small research program, but it's not their heart, it's not in them. There is, if 1 in 10, it is a, say, high proportion. Sure. Not everybody is made for a researcher in surgeon.
The one piece of advice as well, which is sort of building off of what both of you have said, which is I think there's 2 buckets of work, academic work, that can be done. There's the sort of the stuff you can do short bursts of time, read journal articles, do a manuscript review, do some of this administrative work, and that kind of stuff I do between cases. Yeah. And the other thing I do is put multiple cases on a day, and that way I fill my clinical day, get the cases done. But it's really important in my mind to be able to focus on your research. And it's hard to really think of a hypothesis-driven project clearly and understand all the problems in between cases. It's also very hard to write a really good manuscript in between cases. So you need to focus time on that.
Agreed.
And you have to defend your time. That's one lesson you learn very early. Time defending. Now this, I want to be free.
Absolutely. Well, this has been such a wonderful discussion. We are running a little bit short on time. Does anyone have any closing remarks they'd like to share regarding really the important role of research in advancing all of our academic careers?
Good luck with it, and I hope many of you are interested in academia, because it's vital to our survival as cardiothoracic surgeons.
As I said in the end of my talk, I still think the academic career is the best possible fulfillment for an intelligent, well-trained young surgeon.
Yeah, I think there's a lot of talk that cardiothoracic surgery is dead, and research is a dead end, and I just don't believe it, and I think there's so much evidence and so much things that show you that cardiothoracic surgery is a very rewarding career, and doing academic work on top of it is really the icing on the cake. So I join Pavan and Dr. Turina in sort of a call for everyone to really pursue that combination that is tremendously rewarding and exciting.
Absolutely.
Wonderful. Well, thank you very much for your attention.
Thank you.
Very well.